21 Drops, essential oil therapy that helps you be your best self.
Now that you understand where essential oils come from and how they work, we're going to talk about dilution and safety. As we discussed earlier, it takes 4 pounds of plant material just to create 1 ounce of essential oil. So this needs to be diluted safely. So we would need to know, first of all, who we're actually applying the oils onto. So whether it's somebody who's elderly, a child, someone who's pregnant. Usually in those 3 conditions, we would use something only a 1% dilution of the essential oil into a carrier oil. If we were using an all-over body massage, we could use a 2% dilution. In applying to just small areas of concern or else for areas of pain or stomach problems, we would be more direct and we would do anywhere from a 3 to 5% at most. You would never want to put pure essential oils directly onto the skin without diluting them. It's not safe, it's too much for the body to handle at any one time, and it's just really wasteful, really, because essential oils are so powerful, you only need a very, very little bit to be effective. Here we have 4 examples of just some carriers. The way to use essential oils is endless, really, but we have like here an unscented lotion. We have some salts that you could create like a salt scrub to be invigorating, get things stimulated. Here's just some pure coconut oil, which is a little more dense. It's going to stay on the body longer, so you wouldn't need as high a concentration versus something that's absorbed quickly, like your lotions. And here's a organic jojoba, which is what we use. It's a great oil that's nurturing to the skin, but there's many other oils. And if you get into creating your own products, there's certain oils that are infused with herbs. So the carrier oil world is endless. But we're really focusing on the effects of the essential oils. And a common question that we also get about essential oil safety and usage is about ingesting oils. And I just want to make sure that people realize that ingesting essential oils is not something that we recommend. The concentrate of essential oils is very, very strong for the intestinal lining, the esophagus. And not only that, when we apply essential oils, we're inhaling them or they're absorbing into the bloodstream, they get to work right away. So it's really not going to be as effective as just inhaling them or applying them directly to the skin. It's very dangerous, they're very strong, and you would even adding essential oils into water. Oil and water don't mix, so by just adding essential oils into water to be drinking them is really, really not safe because it's not diluting the oil. The oil floats on the surface, and unless you have a hydro and lipophilic substance of what you're putting essential oils into, they are not going to be really properly diluted. So putting pure essential oils into a water substance is not diluting the oil at all. And so by drinking those oils straight, it's really hard on the system. We don't recommend ingesting any essential oils because actually they're much more effective by inhalation or topical application. I know we've covered a lot of information, a lot of topics. For more information, you can always visit our website, www.21drops.com, and there's an Ask Carrie section on that website, so please feel free to reach out for any further questions. Thank you.